It's Movement Cue Monday, and this week I want to talk about taping. The why I would tape, the why I should tape this way, and the why would you do that. Most of the people that I see that think that taping doesn't work have either tried something they saw online that's just a random one, or they've seen the crazy memes on the internet like this. So let's go ahead and show you a couple different ways to tape and why we would use those in your life. First is neurosensory taping. Now we would use this just to help with pain basically. So if you've done a hard workout or you've done something that's injured a muscle and it's really sore, this is what we would use this for. So what you're gonna do is just rip a little bit of the piece of tape off, a little bit of the backing. Put this on the muscle or area that's sore. We're gonna put a stretch on that muscle. And then with the stretch on the muscle, you wanna give about a 50% stretch on the tape. Pop that on and make sure that you don't stretch the edges of the tape because that can irritate your skin. After we've done that and you go back to a position that's not stretched, a lot of times you get a few wrinkles in the tape, which help to lift the tissue and get any inflammation out. And typically I say this is a lot like if you get hit in the arm and you rub it and it always feels better. The tape is basically doing that the entire time that we have it on. So it's the first method of tape that we use. The second type of taping, which I use all the time, pretty much all of my tape jobs are using some form of this, are tabbing tapes. So what you'll do is take leukotape, a different form of tape. And with this, you will create a little bit of a tab by folding it over itself and having a tab there, and then you can put that on top of the first layer of tape that you put down. Now, many times if you can pull the skin in a certain direction, testing out a few different directions, they can decrease the pain immediately and give you a break. So I like to use the tabs to find that type of skin pull that feels good. Then we can use that tab with another piece of leukotape to pull the skin into that direction that decreases your pain. And that tab will stay on the entire time the tape's on. So we usually get a few wrinkles in the skin, and this can help significantly just give it a break so that you can continue doing the things that you want to do. That's tape job number 2. And the third type of taping that I use in the office all the time is an EDEMA tape job. What you're going to do is cut little strips into your tape like this, and as we put this on, we're going to create kind of a fun little squid design. And this is almost the same method. You want to have a little bit of a stretch on the muscle as we do this, and you'll put a little bit of a stretch on the tape. Basically what you'll do is just form a pattern all the way over that injured area that's swollen. And many times you can see pictures of this online that show a bruise that has this pattern kind of taken out of it. And that is the tape lifting on the skin and just helping push out some of that inflammation. Sometimes you need an actual assessment to find out what sort of taping is going to work best for you. But a little bit of an explanation of how each one works and why you should use it is usually helpful. So if any of these sound like something you could use, then go ahead and give it a shot. Because if you can fix yourself, you should. And if you can't, we're here.